This is still HealthAfrik on AAU TV, and it is brought to us by the Association of African Universities. You can follow all of our discussion on our social media handles at Association of African Universities on Facebook and YouTube, AAU TV _ African Universities on Twitter, and AAU TV official on Instagram. We are still discussing osteomyelitis, and with me is Dr. Kwame Nimaku NG from RNM Clinic. Doctor, you're welcome to HealthAfrik once again. All right, so moving on to the diagnosis and treatment, I would like to know, let's say, on the first segment, you made mention of some symptoms of osteomyelitis. So if I'm experiencing these symptoms, when should I see a doctor, and then who can treat osteomyelitis?
Okay. So with a symptom, as I said, it will be non-specific, but more importantly, bone pain with some swelling, and the patient can't really understand what's exactly the problem. There's not been any trauma prior to the swelling. So ideally, the person can, walk into any primary healthcare facility or any hospital close by to the patient. So then they can then assess, to ask a few questions to know the circumstance, how it all started, so they can make a diagnosis. So as I said, it's not specific. But then when you if you visit the hospital, you can start to investigate what the possibilities could be. But essentially, with the pain more being in the bone, it could be anything. So beside osteomyelitis, it could be, if for instance, if it's here, it could be osteomyelitis or septic arthritis. If it's an elderly person, it could be arthritis because it's closer to the bone. It could also maybe an early phase of the cancer that is there. So once you report to the clinic, it's just a bone pain, but it's important you report as soon as you notice something. Because whatever it is, the earlier it is identified, the earlier the treatment, the better the outcome. So anytime there's a bone pain, unexplained, no trauma, you will need to visit the clinic.
All right. And then who can actually treat osteomyelitis?
So what it is if you get into the health system, wherever you report, they'll start with the investigation. And then when the diagnosis is made. So osteomyelitis can be treated within hospital. It cannot be done out of hospital. So essentially, you would have to be in hospital for quite a while. So depending on the extent of what it is, one would have to be on antibiotics for quite a while. So, you have to be in hospital for quite a while, depending on what's the extent of the problem. If it's an early phase one, whereby it was identified easy, the person reported early, treatment was initiated soon enough, with IV antibiotics in hospital, the outcome is good. But when it's delayed, that means that you would have to get long duration of IV antibiotics. So whenever we're saying IV antibiotics, we are looking at in-hospital administration. So essentially, when you get into the hospital system, ideally, let's say early phase, the initial hospital sees, that did the assessment, realize that, this one would require some surgical intervention. They would have to refer. But when you get into a hospital, realize they did assessment, did an X-ray, and realize that it's not too bad, just more like an early phase bone pain. They can start IV antibiotics and maybe then refer you to orthopedics to oversee what has been done so far in the long-term plan.
All right. So talking about diagnosis, so you made mention of X-ray. Aside the X-ray, which other method can be used to diagnose? So
for any infection, you usually want to have a fair idea what the full blood count looks like. The full blood count, you're looking at the blood level and then other parameters. So that is about the WBC, white cell count, the platelets, and then the RBCs, the white blood cells. So then it tells you how these ones look like. Essentially, when you look at somebody who has osteomyelitis, because of the ongoing infection, if it's early, maybe early or intermediate, you may not see so much on full blood count. But with time, parameters change, the white cell count will go up. So then beside the full blood count, also we'll look at the ESR. That talks about the evidence of some inflammatory process ongoing. So the ESR simply means erythrocyte sedimentation rate. That tells us about how fast the blood is falling down. You see, when anything is heavy, it falls down too fast. If it is light, it takes a while to float, and then down it goes. So the faster it is, tell hey, there's something that has to do with the red blood cells. But when there's an inflammation, there are a couple of things that change within the blood, and that makes it fall too soon. Now, and then the X-ray, those are the main key things that has to be done. But for instance, if they are suspecting other possible causes, they will look at other tests. For instance, maybe the arthritis is not really osteomyelitis, you want to be sure that it has nothing to do with rheumatoid arthritis, they will look at some other tests. So they may look at maybe rheumatoid factor, they will look at antinuclear antigen tests, antibodies, all these and other investigations, just to make sure that these are not other possibilities. So whenever they do the test, not like they are trying to waste all their money, but they also want to make sure that these other ones are ruled out.
All right, okay. Now, talking about treatments, I'd like to link it to the types of osteomyelitis. You made mention of chronic, acute. Now, when someone comes to you and then you realize it is chronic osteomyelitis, what are the treatments you're going to give to this person? And then when it's acute, what are the treatments you're going to give to this person? And then the other types of osteomyelitis.
Okay. So, as I said earlier, the timing is what changes everything. So, the person reports to hospital, symptoms start maybe a week or two earlier, then we start IV antibiotics, did an X-ray, realize that it's just some small change in the bone structure. Then start antibiotics, realize that it was doing well, then suddenly realize that the person is still complaining about pain. Before we know, 1 week is gone, 2 weeks is gone, it's almost the 5th week. You realize that you're repeating the thing, realize that things are looking different. Cultures have been done. Nothing particularly. So then you probably will let the orthopedics have a look at it. With that one, they may want to probably, depending on the stent, maybe the whatever it is localized, but causing significant changes there. It hasn't spread to the blood. So when you do the blood culture, you didn't see anything. So maybe it's probably one that was probably from either the person has reduced immunity for some sort and predisposed. So mean that the blood culture didn't show anything. So with that one, the orthopedic surgeon may want to probably do some minimal procedure just to be able to take some cultures to see what it is. Well, in the case of acute, they may not really see much per the signs. But in terms of chronic, what happens is that now there are some codes that have been created within the bone, such that it forms what we call sinus. So such a sinus is simply there is a communication out from within. So that one causes these things that are being generated from the reaction to probably come out. And when they come out, they push the bone lining off its usual position. And then what happens, they realize that new bone starts forming underneath the old one. So that means that from what we have is now we have an inflammatory reaction that has generated more like fluid within. With that, there causes pressure in there and start pushing the bone that was initially fine up. Then you realize that the new area that is there starts also forming new bone just beneath that area. So what we realize that now we have an old bone, then you have a new bone forming, then you have something that is there. So what is surgical? Usually orthopedics are the best people to manage osteomyelitis in that stage. What they will do is that they would want to drain what is there. Okay, IV antibiotics very long, could be very long. I don't want to make mention about the time. So that's how come everybody would have to report soon enough if they start experiencing any unexplained bone pain. So with that, they would want to maybe drain what is there, 1. 2, they may want to do some procedure there. Because of the, let's say, it's contaminated, bacteria instead, so we want to drain, do some washout of that area to make sure that whatever inoculum is there, they reduce the quantity. So that whatever, IV medication that is being given, it's working fantastically. So with that, it depends on the issue. So if it's one that, not too extensive, within time, short period, everything get back to normal.
So is the draining a surgery or?
Yeah, it's a surgical procedure. Surgery.
All right.
So they do draining to drain whatever was collected there. They may do some bone, more like a scission, cut some of the bone that are probably contaminated out. And then in the long term, they would want to do some procedures just to promote the bone healing.
Okay. Now, still on treatment, I like to always ask this question because I know someone who is kind of scared of going to the hospital. And the person may think that there are other herbal treatments or alternative treatments to osteomyelitis. Now, what other alternative treatments are there to treat osteomyelitis?
Okay, thank you very much. So when we talk about, as I earlier explained, we talk about osteomyelitis. It's an inflammation of the bone caused by an infecting bacteria. Now, indeed, there are so many studies that are ongoing in other jurisdictions or other parts of the world that have been shown that there are various herbs, that have been shown to have some antibacterial property. Antibacterial in the sense that they're able to kill or do the work that these antibiotics that we take, they do. So these herbs have been shown to do the work that antibiotic we take does. Now, in our jurisdiction, it's hard to say because we don't have such enough data to stick out to say that this one would work, that would work. There's no scientific data. So on that note, it makes it hard to really, stamp it out to say this would work or that will work or that will not work. However, to the best of standard practice, realize that many a time in our jurisdiction, realize that the best treatment when it comes to osteomyelitis is IV antibiotics.
All right.
And it's been shown to promote good outcome. And then, it's limiting disability. Because in the long term, for anybody who have developed osteomyelitis, stand the risk of, even if it's, for instance, it started like osteomyelitis just here, that can even move into the blood and cause systemic sepsis. And that systemic sepsis can shut down every organ in the body. Every organ. Our kidneys, our liver. So we become more like multi-organ failure. So that can shut down every organ in our body. That thing that started just here, or the wound started very small, you didn't give it so much attention. Before you know, you start having bone pain just beneath the wound. You are just trying to have that, play around it. Or you think you are doing the best, not reporting to hospital. Before you know, some things will start coming out from the bone or from beneath. And you realize that now you begin to feel cold, shivering. That alone tells you whatever it is gone beyond this level, and you are developing sepsis. And that's one, as it goes on and on and on, can now cause more of the bone to break down. More of the bone to break down. And if care is not taken, it can even go close to the bone, the joint that is close by, and even cause septic arthritis. Now, with septic arthritis also has its own complications. So by now, sticking to this one, it can cause deformity of the bone. 2, it can cause some limb shortening. In the long term, you realize that, if let's say it happens in a very early stage, let's say a very young child, realize that the person is before puberty or before 25 years, it affects the person's limb length. So whether one leg is even longer than the other.
All right. So after treatment, I know for sure you are going to prescribe some post-care activities for the patients. What are some of these post-care activities you prescribe for the patients?
Thank you. So one, we are dealing with a bone problem. And often than not, because the person might have been immobilized for quite a while because of therapy, and though in hospital we will do some physiotherapy, post-discharge we discuss that as well. One, the person upon discharge will have to visit the orthopedic surgeon on some days to repeat investigation for reassessment and all that. 2, the person would have to do some physiotherapy, in that you would want to make sure that the adjoining muscles around that area are not affected and they are not problematic. They will not develop any complication thereof. So that when you are looking at avoiding the complications. So some physiotherapy will limit getting any sort of stiffness around the joints thereof. Then you also want to, in the long term, let's say the person's osteomyelitis took quite a while before they reported. Now, orthopedics could come in with, if there's a limb discrepancy that happened, it could come in and then probably the long term, maybe if the patients want it, institute more like limb lengthening, such that they are going to do some procedure, more like trying to lengthen them so to reduce the discrepancy between the other limb.
Now, as the saying goes, prevention is better than cure. So I'd like to know some preventive measures for osteomyelitis.
So prevention. We can start by saying that having the knowledge alone is prevention to start with. And then 2, anytime you have any wound, one should not underestimate it. Any wound at all, one should give it as much attention as possible. It heals you and the wound parts, everybody is free. Because any simple wound can become, can lead to osteomyelitis, irrespective of wherever it is. It may be here. Don't forget that every area there is a bone. Once there's a bone, osteomyelitis can develop. 2, well, you're not lucky, you develop the bone, now you start realizing that you didn't give much of attention, now it's becoming problematic. As soon as possible, report to the nearest hospital. Get treatment, try and comply with what they say. You may not be happy what they are saying, but in your best interest, just agree with them. Once treatment is initiated, treatment is done, you say thank you, you go your way, they have gone their way. So at the end of the day, you don't develop any of the complications that have been mentioned.
How about exercising?
Oh, it goes with the, Directly, one would say that when it comes to osteomyelitis and exercising, not directly. Because what it is that it's a bacterial infection that's caused that. But one thing I can say for a fact that regular exercises boost our immune system. Regular exercises, balanced diet and all that boost our immune system. So with that alone, you are trying to do everything to boost your immune system. So that means that you will not develop unexplained osteomyelitis of some sort. And then if you are taking any medication, or you have to, or if you decide taking any medication without your doctor's advice, you have to be cautious. You always need to, discuss with your doctor or your clinician whenever you're supposed to take any medication. So it does not lead you to reduce your immune system, now predisposing to getting osteomyelitis. I'm not saying that, not like once you're taking any medication, it can let you develop osteomyelitis. No. What I'm trying to say is that once, let's say, you're taking some medication that reduces your immune system, that's more like a side effect to some degree. What it is that if you develop a cut, you should give it much of attention because you stand the risk of developing osteomyelitis. Not like the drug is going to make you develop the osteomyelitis.
To end this segment, I would like to know, as a doctor, how difficult is it to treat osteomyelitis?
So the earlier the person presents, the easier it is for us. Yes. So because when it's early, you catch it early, you give it treatment, everybody parts. When it comes in late, my goodness.
It's very difficult. How difficult
it can take quite a while.
Is it the treatment or is it the diagnosis that is?
It's the treatment.
The treatment, all right.
Because that's for the diagnosis. Once you make you do an X-ray, you do a full blood count, you do the ESR, it's just there. If you do an X-ray, a person has osteomyelitis, you realize that there are some changes on the X-ray. It's just looking at you.
All right.
But the treatment, if it gets to chronic, it can take a while.
A while, all right.
It can take a while. So nobody should get osteomyelitis.
Thank you very much,
You're
Dr.
welcome.
Kwame.